that it's really cool what it can do, and the range of what I actually get it to do is not taking full advantage. I don't know if it's looking at me. I didn't really set it up to do the tracking right now, but anyway, okay. So we are doing, it's a little wobbly today. We are doing some review, and we're especially going to hit some vocabulary concepts, more kind of dive into how to maneuver with medical terminology. And also, yeah, everything's connected. And we can pop through some endocrine review, some respiratory review as well. Okay? So I'm looking at our set of terms. And this is just really nice laid out. So let's kind of go all the way back to our grade school concepts on language and just think about how words actually work, how they're composed, how they are clicked together like Legos in order to combine these different concepts, right? So our first kind of adapter in the first slot on the word is the prefix. And so it's pre, the beginning, before, right? Previous. That's clicked onto the front of the word. The root word is the most central concept of what's being expressed in this new compound word that we're making. And then the suffix is what's stuck on at the end of the word. So let's go over maybe root words first so that we start at that core. And the way that these words are combined in medical terminology, most of these words are going to come from Latin. Some of them are actually from Greek. And we get these funny compounds that are a convenient prefix from Greek stuck on a Latin root word. Sometimes that happens. It's okay. And then the end result is a term that it can be quite specific to the body concept that we're trying to describe. So our root words, I will just read through the root, and then we've got that meaning that's associated with the root itself. Abdomen would be referencing the abdomen. Aden or adeno is referring to a gland. Adreno is the adrenal glands specifically. Angio would be the vessels. Arterio for arteries. Arthro for joints. Broncho for bronchus, bronchi, that tree of the lung where the two lungs are intersecting and feeding back up into the throat. Cardio for heart. Cephalo for head. Chondro for cartilage. Colo for colon. Cost is ribs. Cranio, skull. Cyano would be references to blue coloration throughout the body. Cyst can refer to either an actual cyst as we think of it, of a pocket of fluid that's trapped in the skin. It can also refer to a deliberate pocket of fluid, such as a bladder. Cyte or cyto is our cell term for just the individual cells of the body. Derma refers to the skin. Duodeno is that duodenum, that's that intersection on the intestine. Encephalo for the brain, entero for the intestines. Fibro for fiber or fibrous tissue generally. Gastro for stomach. Gyneco being specifically referencing female anatomy. Hema, hemo, or hemato for blood. Hepato for liver. Hydro for water. Hyster for uterus. This is kind of like a fun, exciting offsides comment, is the word hysteria in English is descended from the idea that the uterus was believed to literally wander around in the female body and to be the cause of the unpredictable female emotions and like manic episodes or whatever being attributed to women. Interesting move there. The ilio is the ilium, larynge or laryngo for the larynx, that's the voice box. Mammo, breast, mammary gland. Or myo for muscle. Myelo, specifically the spinal cord or bone marrow. Nephro, kidney. Neuro, nerve. Oculo, eye. Ortho, straight, normal, or correct. So orthopedic being straightening out. Yeah. Osteo, bone. So osteopath is a bone doctor, yeah. Ot or oto is ear. Ped or pedo can be either child or foot. Pharynge is a pharynx. Phlebo is relating to veins. Nia, when that starts with a P, is breathing, respiration. So like pneumonia. Neum, pneumo, lung, air, gas. Procto, so this is the rectum. Psycho is the mind. Pulmo is another lung reference. Pio, pus. Recto, also rectum. Rhino is nose. That's kind of a funny one, a little easier to remember. Maybe if you think of how big a rhinoceros's nose is, that's why we called them rhinoceroses. Steno, narrow constriction. Sterno, the sternum. Stomato, the mouth. Thermo, heat. Thoraco, the chest. Thromb, clot or thrombus. Thyro, relating to the thyroid. Toxic or toxico, poison or poisonous. Tracheo, referring to the trachea. Uro, urine, urinary tract or urination. Urethro, the urethra. Urino, urine more specifically. Utero, uterus. Vas, vaso, blood vessel, or sometimes the vas deferens, which is the gap that in the gonads, the sex cells go across. So you have that in the female at the ovaries and in males at the testes. Veno for vein, and vertebro for spine or vertebrae. So those are kind of our core words. This gives us a pretty solid cluster of terms that can get us to where we're happening in the body. So narrowing down which body system you might be in by the time that you are trying to talk about it and grabbing for these words. So prefixes that you may need to use in order to modify some of these common root words. And again, you're not in a position where you're having to generate these words, but this is like a code to break down. If you find an unfamiliar medical term, you can piece it apart and either know how to start looking it up or just kind of intuit what the possible relationship between this root and this prefix or suffix might be, right? Okay, so our common prefixes will have a or an, meaning without or not. Ab, away from, like our abduction. Ad, toward, adduction. Ante, meaning before or forward sometimes. Anti, against. So that's kind of useful to make a mental note of that distinction. The ante with the E is before versus anti with the I, against. Auto means self, directed in towards self. Bi means double or both. Circum would be around, going around. Contra is another against or sometimes more specifically opposite. De is down from. Dia is across. Dis is separation or away from, without. But with a Y, dis is like in dysfunction, bad, difficult, or abnormal. Ecto would be the outside layer of something, and en or ento or endo would be in, into, within, inner, or inside. Epi would be over and on. Eryth is red, so like our erythrocytes, our red blood cells. Ex, out and away from. Hemi, half. Hyper, excessive, too much, or above. Hypo, under, decreased, less than normal. In, pretty reasonably. In, into, within. Sometimes not. Sometimes we'll say in, meaning not including that. Can you think of an example of that in English words? Like infrequent, right? Okay. Inter, between, and intra, within. Sometimes you'll hear intra as in like within but kind of across. So those are a little bit tricky ones, but you'll feel it out. And then that's also, we have a contrast there with intro, meaning going into. So inter is the in-between space. Intra is within, so like intracellular fluid. And intro, going into. Okay. Leuc is our white, so like leukocytes, yeah. Macro would be our large term. Like it's the extra large version of whatever the root word following it is going to be, or the bigger picture version. Mal would be bad, illness, disease, like maladaptive breathing, right? Mega, large. Micro, small. Mono, one or single. Neo would be new. Non, not. Para, abnormal. Per, by or through. Peri, around. Poly, many or much. Post, after or behind. Pre, before or in front of. Pro, before or in front of. Re, again. Retro, backward. Semi, half. Semi versus hemi, I would point out, are like a little bit variance on how you'll usually hear it. Is a hemi is going to be a crisp 50-50 half most of the time that you see that. Semi may have some wiggle room there. Like you might be talking about a 45-55 distribution, or more so, but anyway, divided into two parts, semi. Sub, under. Super, above, over, or excess. Supra, above or over. Trans, across. And uni, one. Okay? So all of those prefixes would be at the beginning of a word, and the prefixes are, as you can hear, they just like sound like they don't make sense as standalone words. They really have to get jammed onto one of those root words to start meaning something. And the suffixes also work that way, but they're often a little more complex than the prefixes, and they're going to be, is that a boat horn? Sorry, it's distracting. Okay, the suffixes are a little more complex, and they're always going to be stuck on the end of the word. So there's not quite as many of them in this list. I kind of like them. Suffixes might be my favorite. All right, allergia is pain. Asis is a condition, and we're usually going to be talking about conditions that are abnormal. We're not going to give names to, it's totally fine and nothing is interesting or wrong with it most of the time. So technically it just means condition, asis, but it's usually going to signal to you that it's a variation from normal. Cele, hernia, herniation or pouching. That one's pretty uncommon, I would say. Site is a cell. So a lot of times you'll get the name of a cell is one of these root words plus site, or even possibly a prefix. So like you have the leukocytes or erythrocytes, right? Ectasis is the dilation or stretching. Ectomy is excision or removal of. So that's a surgical removal of a body part, generally, ectomy. Hernia would be generally a blood condition. Genesis would be the development, production, or creation. So we had I feel like we used that not too long ago. Does anybody remember that? You could talk about hemogenesis or hemopoiesis.
That happens in the bone.
Mm-hmm. Right. Genic would be producing or causing. I'm like scanning for if I can make a good combo example for you. Okay, we'll just keep going. Gram would be a record. A graph would be a diagram or a recording instrument, or graphy would be the making of a record. Iasis would be a condition. Ism would be a condition. Itis generally is an attempt to refer to inflammation. There was a window of time where a lot of medical terminology was being generated, and the concept of inflammation was pretty new, and so they were kind of sticking that on a lot of things. So you'll sometimes see itis used, and it means inflammation, but ultimately it's not actually describing inflammation, such as plantar fasciitis. It turns out that condition is not inflammation of the plantar fascia. This is not exactly what's happening, but that's still the name of the condition, so we're rolling with it. Ology would be the study of. Lysis would be the destruction or decomposition of. Megaly would be enlargement. Oma is a tumor. Osis is another way of saying condition. Pathy is disease. Penia is going to indicate that there's a lack or a deficiency. Phasia would be speaking specifically. So you could have aphasia, where the person's condition is not speech production, like that they're struggling to produce speech, right? Phobia, exaggerated fear. Plasty would be any surgical repair or reshaping. Plegia is paralysis, so specifically like motor neurons are deactivated in that region. And then this is hard to say without it being in a word, but rage or ragia. So hemorrhage would be our blood term stuck with rage or ragia. That's the excessive flow. Rhea would be profuse flow or discharge. Diarrhea will be the most recognizable high frequency use of that. Scope would be an examination instrument. Scopy would be the examination using a scope. So the scope is the instrument. The scopy is the act of using the instrument to look at something. Stasis would be the maintenance or maintaining of a constant level. Stomy or ostomy would be the creating of an opening, so like a colostomy, an opening in the colon. Tomy or otomy would be the incision or the cutting into. And urea would be a condition of the urine. So a phrase using that would be like proteinuria, that the urine is containing a high volume of protein in that time. So that is our whole set of root words, and we did record it, so you can replay it while you drive around if you want. Anything on these prefixes, root words, or suffixes that you guys feel like we want to revisit?
No, I think that's a good list, and if I study that, I'll be able to discern the meaning of many words that I hadn't seen before.
Yeah. So just a few more, like maybe replay if that audio is helpful, or spending a little time looking through this. It might be also useful to just kind of flip through the rest of the book and find words that are still kind of unfamiliar and see if you can work them out now that you've got the code. The secret decoder ring of our Latin and Greek root terms. Okay. Also, in this segment on medical terminology, while we're here, it may be useful to hit this section of common abbreviations. I might not actually read through the entire thing for you here, because I think you guys were already very patient, and we don't necessarily need to do that. But abbreviations are specifically when we have an agreed upon shortening of a phrase, usually for charting. So it's just the letters or symbols that you're going to use as shorthand to represent an idea. A lot of times you don't have to really use them so grammatically. They don't have to fit into the whole phrase in a way that exactly makes sense. But when you're describing in your charting something like you want to refer to the abdomen, you might not write out abdomen every time. If you write ABD, that's going to make sense to you and to the next person after you. Cancer we'll see as CA. AM in the morning time, so you might have a note of like pain is worse in the morning time, AM. Diagnosis, these are some of the good ones with anything followed by an X. That's really indicating this is a word that is written in charting at such high frequency that it's just, we took the initial and it's just X. And so those ones are worth a little extra attention to. DX would be diagnosis. FX would be fracture. HX would be history. Don't call me while I'm videoing. PX, prognosis. Do you understand the idea of a prognosis?
Yes.
Okay. That's just our expected projection of the course of healing that is likely to come out for that person based on the information that we currently have. Obviously, it's not a promise about when somebody will be better or how many months they have left to live or how long it will take them to reach a different pain level. But if we can make an educated guess and help kind of clarify what to expect, that could be helpful. PX. RX would be a prescription because we already used P, so we had to use the next letter on prescription. And TX is treatment. That's probably the highest frequency abbreviation that I use of them all, TX. And you'll usually want to put that with a capital on that first letter and the lowercase on the X. And when as you guys dive into phase 2, you will have a lot of opportunity to do some charting and have some like review on how your charting is going. But always remember that the most important audience for all of your charting is generally you. So making sure that you can get that information back out in the future is like the gold standard on charting. Of course, if you are submitting things to insurance companies, then you're going to want to have it be clarified out a little further than you might necessarily have to write for yourself in order to kind of justify and explain that you are inside of the prescription as written. But that's our terminologies overall. How's that feel?
Good.
Okay.
Yeah. Thanks for having me.
Maybe let's pull out, do you guys happen to have the vocabulary list that Marco gave you on you?
I do not.
Okay. I have mine. I think I just have this one copy. But this will be a great source if we want to just kind of play around with these prefixes and root words real quick. Go ahead and you can use mine, Karen, and just scan over if any of those words, especially words that were unfamiliar the first time that you read them, might be a little bit easier to work out with our common root words, prefixes, suffixes.
Let's do carbonate.
Carbonate. Okay. Well, our root word on carbonate is going to be carbon. We're talking about just the atomic carbon. And it's not actually giving us ate as a suffix, but that's going to mean to do a thing to, right? So we're adding carbon into whatever is becoming carbonated. How's that showing up on the, is it connected to anything on the way that the vocab list has it?
No, it doesn't. I don't
Okay.
think. We didn't ate anything.
We didn't ate anything. Not in here. Not us. I feel like this is super dirty.
Also, we got another one in here that's kind of foreign to me. Ileocecal.
Oh, okay. Yeah, that's a great one. So,
This one down here. Ileocecal.
also not well represented on our, oh geez.
C-E-C-E-C-A-L.
Yeah.
Of the iliac something, because isn't oinocephalus top?
Yeah, it's not giving us cecal on our suffixes either, but it is that we're talking about the iliac. So ilio, take a look at it. Gosh, I can't think when I've had to see that word since school. Iliocecal.
I'll look it up in my medical dictionary.
Yeah, maybe we have it in our, I think this is great that we're just kind of taking a little time to play with how do you even find this stuff out? So our index of the Mosbys is often a really great resource for that. Ilio. And it is actually not showing up.
A valve, a junction, a sphincter, ileocecal valve massage, ileocecal valve location,
Okay.
ileocecal valve syndrome.
So is that
ileocecal
maybe
resection.
referencing some kind of like specific abdominal massage?
It says, this type of massage can be used as a self-care technique in your quest for good bowel health and general well-being.
Good bowel health. Awesome.
Another way to locate the valve is to place your left thumb on your navel using your right thumb on your right hip.
Okay.
Then visualize a line that joins these 2 points and find the middle of the line. So part of the stomach massage.
Awesome.
So, yeah, you could get a stuffed ileocecal valve in a closed position, and that would be not good for you.
That makes sense. So we're talking more about like the ileum in that case, in the iliac.
So I think that's what I'm gonna do with that list. I think I'll just go through
Yeah,
the ones
just-
that I are not
I think
familiar
that's a
with
good
and
idea. Just
look
spend
them
a
up
little
in
bit
my
of
medical
time
dictionary.
clicking
Or
through.
Google them. 'Cause
Mhm.
Google is so good.
Google is pretty powerful at this point. You can also apparently ask ChatGPT just to explain things to you. Sometimes because Google can only give you what somebody else already wrote, right? But ChatGPT will like keep trying to re-explain it to you until you're like, okay, I understand. That's kind of fun.
Okay, here's a good one. Sacrospinalis.
Okay, yeah, sacrospinalis. So we're gonna
So
know
that'd be the sacrum.
exactly. So we're
Right.
connected to the sacrum.
And the spinalis,
Mm-hmm.
well, sacrospinalis. It seems like it's a part of the body. It doesn't seem like a syndrome.
I like this
or
guess.
anything like that.
Right. We don't have any of those suffixes that would make us think that we're talking about a condition per se. I'm going to see if I can find a picture of it for you. That's actually not showing up in this trail guide either. This is like tricky vocabulary. This list was
speak English as their first language.
yeah, to really help direct that. But even for those of us who do speak English as a first language, it's not in the indexes of our textbooks. So it makes me wonder, to what extent is this?
Alice prefix means abdominal or femoral.
Mm-hmm.
It's a muscle.
Right. I was trying to just find it in the trail guide for you.
It's a group of muscles.
Maybe.
They lie on either side of the spinous processes of the vertebrae and extend throughout something.
I'm gonna track
Click
290.
on Wikipedia here. They straighten and rotate the back. Wait, that's erector spinae muscles.
That makes sense that that is a grouping. And we already knew to go to the sacrum and to the spine. It sounds like a muscle, so we would start out with looking for a muscle that is attaching at the sacrum and at the spine, right? There are a lot of really fine muscles. Like, we're nowhere near having to actually memorize the full set of all the muscles that exist in the body, especially at this course level. So I will candidly admit I'm not 100% clear how they're defining that grouping.
You want me to read it to you from Wikipedia?
Sure.
Okay. What is the sacrospinalis?
The
Erector spinae is not just one muscle, but a group of muscles and tendons,
Okay.
which run more or less the length of the spine on the left and the right from the sacrum or sacral region and hips to the base of the skull. They are also known as the sacrospinalis group of muscles.
Oh. So we're getting does it feel like it's saying clearly that it's just an alternate term for the erector spinae?
I think it didn't say
Muscle
that
of
just
the-
then, but I think maybe it will say that.
It's a spinalis, not the spinous, right?
Spinalis?
Spinalis.
It's spinalis.
Sacrospinalis.
There's a sacrospinous ligament.
Mm-hmm.
So we need to move it.
Yeah.
It's a group of.
The Wikipedia is describing the erector spinae and then saying they are also known as sacrospinalis group of muscles. So to me, that feels like just a alternate term, one of those ones that is a little archaic, a little less used these days. But it does make sense based on the information that we had, and we were able to generate a reasonable guess as to what to do. If somebody had been like, can you please massage my sacrospinalis, and you were 100% just like had to wing it, where would you have gone?
Down to the sacrum.
Down to the sacrum, along the spine, yeah?
Yeah.
So you would have got there. You
Part
pretty
of
much
it, but
figured
it
out.
sounds like it goes all the way up here.
Right, the description, that's a confusing bit where they're describing it as like the same as the erector spinae group. I would have maybe liked to see it be like a subset of the erector spinae, but if we get more resources on that one, let me know. But I feel good about that. Like this is literally part of the experience of like acquiring the medical information. Is you'll see words, the volume of medical jargon and vocabulary that exists is so far beyond what any one person could possibly usefully retain, that like it doesn't matter what field you're in or what specialty you're in, you're gonna run across these like anatomical words. And don't let people make you feel stupid about it. You're not going to know all of them. There's no way. So we've got the set that we're studying for the exam. We have this set for this list, but you are going to run across words that make you go back into the textbook, words that make you look up something on Wikipedia, find clarity. And yeah, I want to set you guys free with that confidence. Like, I didn't know for sure what a sacrospinalis, and so it goes. You can get pretty far with your best guesses if you're willing to do a little extra research and really nail those roots and suffixes, hopefully. Okay, let's revisit. How are we doing? I know I started really late, so I need to keep extra
It's 10.
track. Do you guys want to do a break now? And then come back and kind of revisit our endocrine questions.
Okay. Sounds good.
All right, sounds good. I will pop off for a minute, and we'll be back in 5 or 10 minutes.